All right, let's go to the next one. Um, Jill, what do we got? I think it has something to do with tele-dentistry. Okay, so this is interesting. So I wanted to ask you guys what you think. So virtual dental care launches dental.com. So there's this big push on tele-dentistry. But the funny thing is, I looked somewhere in ADA, out of all the places, a month ago, when I was putting the news for last month, they had a study done that tele-dentistry is not going to work in dentistry because people are much rather come and see the doctor when it comes to dentistry. So I'm super curious to see what you think, if it's the case, if it's not the case, and why do we still see that big of a push for teledentistry, including this dental.com, which is a cool website. I mean, I wish they would use it for something else. But they're pushing this whole thing where patients can do teledentistry and then pick the dentist from this website. Who wants to start first? Ashley?
My first thought is that it's just so much harder to explain an issue, a dental issue, via, you know, virtual communication. Like if I, just need a prescription for whatever it might be, cold medication, like I can get on a virtual call, explain to my doctor, hey, I have a fever of 101. I have these, I'm coughing, I'm achy, blah, blah, blah. They can probably get me something. If I'm like, it's this one, like it's really hard to determine. Like you're looking at x-rays, you're looking at 47
You
different
mean you
things
can't
to get to the
expect a
point.
patient to call and say like my number 11 hurts, like, and give a pretty much a
Yeah.
diagnosis? Right.
Aaron has the tapping test, or the flamethrower that he's testing heat with, and his, and when he's trying to determine if, but yeah, I just don't think it's as practical for dental work as it, maybe like ortho initial consultations is a good place to start, but it's just not as practical overall. And one of the main reasons that people are even going to the dentist is to get their teeth cleaned, right? And that's where stuff is getting diagnosed anyway. So you're not doing any type of hygiene virtually.
Further commoditization of dentistry. I love it. What I'm curious about is who owned dental.com prior to this company and how much did they spend for that URL?
You're always so interested in the cost of URLs. It cracks me up. It comes
I
up at
thought
least
about
once every time I'm around you.
Because I
it's
still
a cool
can't believe I
domain.
sold that one for that much. It's freaking nutty to me. It says AI. What is it? AI photo analysis, followed by virtual advice from a licensed dentist. I would say as a dentist, whoever is the one who's giving this virtual advice, I'd like to know what their malpractice insurance is, because holy crap, someone's sitting on a couch and they're like, I don't know, they said you probably need a filling, and then it ends up being a root canal. And the way people are these days, they're like, I'm gonna sue dental.com and that dentist. I mean, like, how do you diagnose from?
So,
I Go ahead, Aaron.
a true story, during the pandemic, got set up for teledentistry, had maybe 4 or 5 calls. The one that I remember the most was this older lady who had her daughter like set it up so that she could talk to her. And so we were talking, and she started to tell me about, like, she has this problem with her tooth, da da da, and then I have these teeth missing, da da da, and then I kept, like, something wasn't ringing true to me, and I kept asking her questions, and it turns out she had something going on in her mouth that she didn't want her daughter to know about, who was sitting in the room with her. Okay.
Hmm.
And then they want me to prescribe medication for her. You can't see what's going on. Brian, how many times have you had a patient walk in the door and you're like, oh, it's this one back here that hurts? You go tap, 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 ow. And it was the 2, 3 teeth in front,
Uh-huh.
or it was in the other arch. Or, I
Yep.
mean, patients have no idea there is no way to see what's going on. I don't see how this flies. I don't see how it lasts very long at all. And this
I
is,
would like to. I'd like to be like, yeah, cool. So that one looks like it needs to be pulled. Could you go to the garage and grab your toolkit? And I'm gonna coach him. I'm gonna coach him through the. Like I said, you're gonna turn the little thing, and then once it's real tight, just freaking yank it. I mean, that's what we all do, right?
don't get the little pliers, get the channel locks. We're going way in back. We need like
Yeah.
the channel locks is what we need.
And if it doesn't
Okay.
come out, use a little bit of WD-40.
Uh-huh. Uh-huh.
That's
It's
nice.
gonna be good. What could go wrong with this?
Yeah.
Well,
This-
but
this-
can we be a little
Pretty
like
much nothing.
what can we maybe see the other side? Is there like something that they can come up with, like you can, I don't know, put in your mouth like a small scanner or something? That's like
How
a,
much
but
is
they
that going
have
to
to
cost?
mail it to you. I mean, yeah, like what?
And how are you going to get it to them? And what's the guarantee you're going to get it back?
Yeah, for just the what? Just the simplicity for someone to, yeah.
I mean, if you're doing tele-dentistry, basically you're looking for drugs. Now, and I'm not saying drugs in a bad way, but you're looking for medication for some reason. And you're when it's like, hey, I have a cold, my temperature is this. That's a perfectly valid. You can evaluate your symptoms. You thermometer, you figure all that stuff out. When we're talking in your mouth and it hurts somewhere, and I'm not really sure, doc, does it hurt when you bite or cold? I'm not really sure. It just hurts sometimes. How do you test that? I mean,
But
that's
is
crazy.
it in any way helps an office to schedule that patient properly? Like instead of an emergency, put them like somewhere else, or it's all going to be emergency?
I'd just rather have them come in. I don't.
So we were just talking about like how do you go out of network, right? So it's like you got to have a patient who's your avatar. This is not your avatar,
Not at all.
right? Like this just isn't it. So it just depends what type of dentistry you want to do. You certainly could use this to drive patients into your office. I just see so many problems with this, right? Because my brain went there too. Have one of your RDAs sit on this thing all day, and every single person that comes in, I don't know, I'm looking, but I don't really see anything. Let's get you in the office, and then you have someone who's not a dentist
Exactly.
doing your virtual consult. Creates all sorts of. There's a lot of potential misuse. I think. I don't know what they're trying to do. It doesn't say anything other than very vague. Committed to making dental care accessible
Brian,
to all patients.
it
What does
is,
that mean?
Brian, it's teledentistry 3.0. There's something 2.0 and 1.0 that somebody used. So you
This
got to
is
give them
the
some credit.
third
It's
version,
3.0, Brian.
It's
Dude,
improved.
Yeah.
It's new and improved. It's like Tide. It's always new and
Come
improved.
on.
I'm
Yeah.
looking up right now dental care. What is it? Dental care version 1?
No, it's dental.com. Teledentistry. Oh, boy.
Yeah.
All right. I think we should. Yeah.
This is the same issue we have with insurance companies. Is they're like, oh, we're looking at this X-ray and no, that tooth doesn't need X, Y, or Z. Well, where I went to dental school, and probably where Brian went to dental school, they told us, you get a diagnosis by looking at the X-ray and doing a clinical examination in the mouth, and then you can come to a diagnosis. So this isn't even that. This is like maybe we had a picture, we have a patient that tells us what they think is going on, but you're missing the other two pieces. You're missing an X-ray and you're missing a clinical examination. There are emergency clinics where all they do is emergencies. Like you show up at the door, they know they're doing emergencies all day. They're doing emergencies. That's what they're going to be doing all day. And then they'll get you out to somebody else for regular care. So if that's really what you're looking for, like go ahead and do that. This is a poor man's emergency clinic.
I like it says like more cost-effective dental care by identifying treatment needs early. Well, if it's just by looking, when you actually see something with your eyes, that's not early. There's a problem. You can only see that with someone who has like, the magnification and stuff.
Yeah. Well, if you guys